Just a little bit after 7 o'clock, so why don't we go ahead and get started. First of all, Happy New Year. We met just about a month ago, although it feels like much longer. A lot has transpired. So thanks for joining us this evening. I'll go ahead and transition to the chair of the CRAG, Mr. Elijah Wheeler.
Thanks, Adriana. Good evening, everyone. Happy New Year. 2021 is here. Great to see your faces. Hope that everyone enjoyed their holiday season and looking forward to what's hopefully a much better year than we experienced last year in 2020. Just a reminder, please keep yourselves on mute until we get into the part of the conversation where we're having questions and conversation back and forth. And an overview, obviously, as we start with every meeting around what the CRAG is. Being the Community Recovery Advisory Group that consists of you all as representatives from the spectrum of communities, populations, and issue areas here in Montgomery County that's been impacted by the current pandemic that we're dealing with. Your charge is to advise the county executive and county council on the needs of the community during the recovery process and how the county can achieve a new normal that's more equitable than before the pandemic. So we're looking forward to a really good conversation this evening. Obviously, on the agenda, we're going to have housing and rental assistance and a program update, I believe, from Amanda Harris. And we will have a conversation around vaccination and its rollout. So with that being said, is Dr. Stoddard here with us? Adriana?
I don't see him just yet.
Okay.
I know he intends to join us.
All right. Go ahead, Adriana.
Yeah, I was just going to say, I forgot to mention in my earlier statement that we are not live on county cable this evening, but our meeting is being recorded.
Do we want to go ahead and pivot right to the update from Amanda? I know Amanda is here with us. So while we are waiting for Dr. Stoddard to join, Amanda, if you're prepared for an update on the housing rental assistance program, that would be great. Thanks for joining us.
Sure. Thank you for having me. Good to see you, Elijah. Thank you for letting me go first. That's great. Been anxiously waiting. I do have a slide deck. Great.
Yes. And I'll show it a little bit bigger. Just give me one moment here.
Sure. So I thought I would just give you an update on where we are with the existing program, the COVID Rent Relief Program. And then talk to you a little bit about the new funding that will soon be available through the Department of Treasury. So you can see on the slide here, for those of you that don't know, in September, we implemented our COVID Rent Relief Program using the Coronavirus Relief Funds. So it was a total of $21 million that was allocated for eviction and homeless prevention. As I said, we opened the application process up in September. To date, we have received 9,000 applications. The application process is currently closed. We have committed all $21 million. There is a wait list, so people can certainly get their name on the wait list. You'll see here, we did try to target those high need areas. We created a homeless prevention index, trying to identify the communities that were most at risk of eviction or homelessness. About half of all our applicants came from those high need areas. The average rent that was due at the time of application was around $3,300. This program has primarily served people of color. Over 90% of the applicants were people of color, 67% were female, and then the average age was 40. We are pleased to see that we were able to reach those communities. We know that Black and Brown people are far more likely to be evicted and become homeless. In our homeless continuum, over 60% of all people experiencing homelessness identify as Black or African American. So we wanted to make sure that we were in fact reaching those communities. To date, we've put out a little over $9 million. We are still working to process the rest of the applications. People have received conditional awards. We should be done in the next 30 days, getting all that money out the door. On the wait list right now, I just checked, we have about 2,000 additional applicants on the wait list, and we have not done any scrubbing of that. So that number could be less. We do get a lot of duplicate applications. You'll see here on the chart, about 1,200 applications were duplicates. People get anxious and want to apply again, thinking that that will bump them to the front of the line. It does not. It just creates more work for us. Um, so that's sort of where we're at. Other things that we've learned, we did have a fairly high denial rate on this rental assistance program. About 30% of the applicants were denied, and the primary reason for denial was that they actually did not have rent arrears. So they were not behind in rent. They were just worried about how they were going to pay rent moving forward. We also had people apply from other jurisdictions. There's a lot of Montgomery counties out there in the country. So we got a lot of applicants from Ohio and Pennsylvania and lots of other places, which we could not provide assistance to them. But again, the primary reason was no arrears. Now, what we also saw is that 30%, well, about 25-30% of the applicants that were approved had very large arrears and were reporting income of less than $500 a month. So that is something that is concerning, and that with this new money, we want to be able to address. The COVID rent relief for this phase, the maximum benefit was $4,000, which helped a lot of people, but wasn't sufficient for those folks that had arrears in the amount of $9,000, $10,000, $12,000 with really no ability to pay. You can go to the next slide, please. So what we have seen is that this is having a positive impact, at least so far, on homelessness. So in the single adult system, over the last year, we have housed more than 250 individuals. Some of them were served through the COVID rent relief program. Many of them, I think about 100 were served through the COVID rent relief program. And this is more than double than the number that we housed in 2019. So in spite of the pandemic, we are still actively working on housing people. And I think the most significant impact has been seen on the family side. So the number of families experiencing homelessness at any given time in the county has actually decreased by more than 70%. So we only have 22 families in our homeless system as of today, which is the lowest that it has ever been. We actually have vacancies in our family emergency shelter, which we have never had before. And we typically use motel rooms as overflow for families. So I'm hopeful that because of this large investment in eviction and homeless prevention, that it is actually reaching the people that would otherwise enter our homeless system. So that's very good news. Next slide, please. Okay, so other exciting news, you may have seen that there has been more money committed to rental assistance. So in the new, it's not really a relief package, but the new bill that was passed by Congress, $25 billion has been appropriated for rental assistance. And this money is coming through the Department of Treasury, which is good for us rather than it coming through HUD, Housing and Urban Development. With HUD, it comes with all kinds of requirements and limitations on who we can serve. So we're hopeful that because it's coming through Treasury, which the CRF came from, that there will be more flexibility. We expect that Montgomery County will be allocated approximately $31 million in rental assistance. The funds, unlike the previous rental assistance programs, can be used for not just rent arrears, but also utility assistance and home energy costs, and also prospective rent, which is great. So it's not just paying off arrears, but you can also pay rent moving forward if the family is meets the eligibility criteria is still in need. Right now, what we know about the eligibility criteria is that they have to have some sort of COVID-related income loss. This can be a direct link or an indirect link. They need to demonstrate a risk of experiencing homelessness or housing instability, and the income at or below 80% AMI. The Treasury has said that you should prioritize folks that have been unemployed for 90 days or more, and those households that are at 50% AMI or below. So this is all that we know right now. There are still lots of details to work out, and state and local jurisdictions can further prioritize and really design the program as long as they are falling within the guidelines of the Treasury. So we have not determined exactly what we're going to do with the 31 million. I imagine that it will certainly be an extension of our COVID rent relief program. We will likely increase the maximum benefit from 4,000 to probably 6,000, and then try to determine the eligibility criteria for households that we will pay prospective rent, that we will provide a medium-term housing subsidy. That's what we know right now. You can go to the next slide. So questions for this group. Just any feedback on the previous rent relief efforts. If you've heard anything from the community, it would be great to hear about that, particularly about the application process, and people, do they know about it? Do they know what to do? Also looking for any suggestions on how to increase our outreach to those high need communities. It's great that 50% of the applicants came from those areas, but I'd like to see that higher, maybe closer to 75%. So just any thoughts that you have on how to reach communities that are not typically coming and seeking assistance from HHS. And then the final question that I have for you all is, what other groups should or could be prioritized? Even though $31 million seems like a lot of money, there's a tremendous amount of need. So if you have any thoughts about what groups or what specific indicators you think should be prioritized for assistance, I will open it up to you all to give me your feedback.
I mean, have you worked, I guess maybe with the, you know, all the food assistance, you know, because there's, I mean, obviously that's growing, you know, I mean, to me, that would be the best starting point, because those are the people that are probably going to be in the greatest need.
Mm-hmm.
Yeah.
Yeah, we have, but we can certainly do more of that for sure. Thank you for that suggestion.
So a question that I have is, have you all thought about, so the families that are either on the wait list or families that were denied in this round because the old program didn't address, you know, paying rent in the future? Is there any way that they can possibly either, I don't want to say get priority, but the fact that they made the efforts the first time, have some access to this new program early on, or in some way not have them have to apply completely again?
Yeah, so we will definitely pull folks from the wait list. Unfortunately, they probably will need to apply again. The information that we're collecting on the wait list is pretty minimal, but we do plan to reach out to that group. And for any of the applicants that were denied on the first round, we did strongly encourage them to reapply if their situation has changed. And we do have their contact information. So that's a good suggestion that we can certainly make sure that we're alerting them that the program is open again, and here's a new criteria.
I have one more question. Just for clarification, did you say if they owed too many months, they would be denied because it wouldn't really make a difference? Is that what I understood?
No,
Yeah,
no, we definitely still provided the assistance, but
up to the
it's,
cap.
Yeah, but it's only, it only gets them so far. We did with some folks, we were able to partner with other providers, including DHCA and some of our other um, nonprofits that are providing eviction assistance, to come up with a package to help pay off those arrears. But in some situations, if it's $12,000, there's really not a whole lot that we can do to resolve that. And sometimes what we'll do with families that are in that situation, we might help them to relocate and get them set up for in a new place of paying security deposit, first month's rent, and giving them a rent credit, because the dollar amount is just too large. And we've also been working, doing our best with landlords to get them to forgive some of the rental balance, to allow the person to stay there. So if we can, someone owes 12,000 and we can come up with a package that's, 8,000, 9,000, getting the landlord to forgive the rest and agree to not evict, because the last thing we want to do is pay $12,000 and the family has no income moving forward. And then in a month or two, they're going to get evicted again. The landlord's just going to file again. Then we're not really resolving we're not resolving the issue.
Thank you.
Thanks, Amanda. Another question for you here. Is there a number or a hotline that folks can call, especially those whose first language or native language is not English, where they can find out the status of their payment once they've been conditionally approved?
So they can call 311. We are contacting people as quickly as we can. So if someone has received a conditional award letter, I would just encourage them to be patient and wait. We will get to them as soon as we can. But if they want to speak to someone, they can call 311 and they will send that information to us. And we do have a number of people that are bilingual that can call them back in their native language. And if not, if someone isn't available, we will use the language line. And I also see a question here in the chat about if we help people who rent basement or sharing rooms with family and relatives. Yes, absolutely. In this existing program, we did work with people that had informal leases or informal housing arrangements. That was about, I think it was 12 or somewhere between 12 and 14% of the households that we helped were in informal housing situations. I do not know if this new money is going to be available for households that are in an informal housing arrangement. I hope so. We will advocate for that, but it's not clear.
Great. Will, I know you had a question or two.
Sure. Thanks, Elijah. Hi, Amanda. Thanks for that info. So I just wanted to be clear about something you said. So in this new tranche of money, you think we'll be opening it up so that folks don't have to be behind before they can get assistance? Did I have that right? Or did I have that wrong?
So we don't know that for sure. It probably not. We still want to make sure that we are reaching people that are already behind, because there's a huge number of people that are already behind, and I would want to certainly serve those folks first before we open it up to people that are not in fact behind, or are behind only a couple $100. I think what we can do for those households is connecting them with our housing counseling agencies so that they can make arrangements with the landlords for payment plans. Okay.
My concern is, and I certainly understand that. Likewise, understand what you said, that, the amount of money that was being provided in this previous program was in some cases not able to cover everything for folks who were behind. And so I just think I get the tension, right? That you can't, number one, you don't have enough money to help everybody, and you can't cover both everyone's balance who's behind, and you can't sort of front load for everybody who's going to be in trouble. But at least it's been our experience at the Renters Alliance that it seems like a lot of folks are still sort of already drowning by the time there's help coming, and the amount of assistance that some folks have been able to get, hasn't been able to close the gap for them. And so, you know, just ask as we have flexibility to design this program from the treasury funds, and if there are any additional funds coming from the state, that we really think a little bit more critically about how we can close the gaps on both of those sides, just because, you know, I mean, it's our experience. And as you know, the Renters Alliance and other organizations works with DACA and Frank Damaris and that team to sort of get the word out about these programs. And our model is sort of early intervention and education and direct services with tenants. And we think more of that needs to be done, frankly. I think it is certainly important that the county is kind of standing the gap to fight the eviction tsunami, but it's equally critically important, we think, for like early direct intervention with people before they get caught up. So I just placed that there. The other thing you mentioned, just a question about feedback about the previous, you know, program, and you mentioned that there were folks who applied twice. I'm curious. I know you don't have the answer to why that happened, but I'm curious how, if it was just because people had sort of called 311, got in the queue, and hadn't heard back for a while, and whatnot. Because again, anecdotally, you know, we've experienced folks who have had some confusion, and we're trying to help sort out the confusion along with you all. But confusion about how to apply and which to apply for. And so, you know, any of those logistical things we're hoping can be smoothed out a little bit more. I mean, I think you said, unfortunately, some people will have to apply again, which might be confusing for some people, or frustrating for some people. And so, you know, we're just trying to be, I'm speaking we as the Renters Alliance, but like the organizations that are doing this work with the county's housing agencies and HHS, et cetera, are trying to figure out the best way to stand in the gap and be helpful. But it does seem like it's confusing for people, and the evidence that folks got in the queue twice, I think, shows that they were a little bit confused. So, you know, I don't know what the finer solution is to that, you know, other than I know, at least before, and I don't mean to monopolize, before the previous programs opened up, we suggested sort of allowing people to queue up before the door was essentially open, so that you'd have a tranche of people to move in. And for whatever reason, that couldn't happen, and so people couldn't start applying until the gates were open. And so just whatever can be done to cut down on some of that time on the back end, and the duplicate work for you all as well, I think would be helpful.
Yeah. I mean, I think there's a lot of lessons learned, and things that we will do differently this time around. So, you know, it takes a long time. And I think this time around, we definitely need to commit more funding to additional staff so that we can actually process the checks. I imagine, I don't know this to be a fact, that I imagine people reapplied because they hadn't heard anything and they were just wanting to know. I will just say, around the getting people ready or getting people in the queue, I'm leery of doing that, because what we've seen when we have programs like this that are first come, first serve, the people that have the resources and the bandwidth and the capacity to apply are generally the ones that apply, and are not necessarily those that are most in need. So I'm just leery of doing that, because we really want to make sure that we are serving those folks that are most likely to become homeless or to become evicted. But thank you for the feedback.
And a couple more questions for you. This one's a two-pronged one. What's the maximum amount of assistance you provide, and do you assist seniors as well?
So right now, with the existing program that's closed anyway, was $4,000 was the maximum benefit. We are looking to increase that for this next round, just because it's been many more months since the pandemic has been going on, and so arrears are piling up. I'm thinking it's going to be around 6,000, but please don't quote me on that. That's just initial thoughts. Right now will really depend. And do we serve seniors? Yes, absolutely, as long as they have a COVID-related income loss.
Is there, and I know the ICH just released a report not even 2 weeks ago, but you have a ballpark figure on the number of homeless people currently out on the streets in Montgomery County as we speak?
Let's see, it's 22 families. So, and then we've got about 250 single adults in shelter. It just went down. It was hovering around 300, and now it's gone down to about 250, and then probably another 100 that are unsheltered. So I would say somewhere between 500 and 600 people at any given time. We're doing our point in time in just a couple weeks, so I will have a better answer for you in a few weeks.
John, was your question answered in the conversation just now, or?
Yeah.
Okay.
Joel, I had one question. Can't seem to get in. It was about the homeless. I just want to get approximately how many homeless are on the streets now, actually living on the streets in Montgomery County?
So unsheltered, like living on the streets, our last count that we did in October was a little over 100. It fluctuates.
Okay, thank you.
Mm-hmm.
What kind of documentation do you all require to prove that folks are late with their rent?
Yeah, so for this program that's closed right now, the only documentation that we required was a rent ledger from the landlord and a photo ID. Everything else could be self-certified. Your income, your COVID-related income loss could all be self-certified. With this new funding, we don't know yet what the documentation requirements are going to be. I know that folks that are doing this work and the national organizations are all advocating for minimal documentation requirements. So we're hopeful.
And is there a time frame of the real estate in between the time that a family submits their application for assistance and the time which the funds reach their bank account, or do those funds go directly to a landlord?
Yeah, so I don't really have a specific time of how long it takes. I can tell you once they get assigned to a caseworker, as long as people are responding quickly to us and getting us the information that we need, we can process that fairly quickly in about 2 or 3 weeks. But it takes a while to get assigned to a caseworker just because of the volume. And primarily checks are going directly to landlords. There have been some situations where landlords don't want to register in our system. They don't want to provide the documentation. Maybe they don't actually want the person to receive assistance, that we can provide the funding directly to the client.
And another follow-up question to that is whether or not you've looked into any kind of enhancements in software to help expedite the process.
Yeah. We are looking at a different software to do our online application that will help us track things better and to be able to pull out folks that meet the priority criteria. So we hope that will speed things up. The biggest part is actually putting it in our existing system, EICM, to actually cut the checks. There's not enough technology out there to really speed up that process. We just have to have more. We have to have more people. We just have to have more staff to be able to do that work. So that's something that we're definitely looking to increase for this next round.
Do we have any more questions for Amanda? Okay. If not, Amanda, thanks for joining us this evening. We appreciate the information. If you could provide your contact information,
Sure.
perhaps in the chat before you leave, I think that would be helpful.
Sure, I'll put it in the chat. Thank you.
So thanks, Amanda, for joining us. I do believe that Dr. Stoddard is with us now.
Good evening. Sorry I was a little late. I had a call right before this to talk about what's going to happen next week with inauguration and the days preceding or days leading up to it. So obviously, we're living in some very interesting times between global pandemic and threats of insurrection in the Capitol. So obviously, keeping busy that way. Obviously, I think the biggest thing to talk about tonight is obviously vaccine. We have Dr. James Bridgers here to talk about it, so I'm not going to take much time tonight to talk about. You've heard already about the rental assistance program. We're looking to get into additional space there, continuing our work in tracing and content and testing. I don't know if Dr. Bridgers will mention that, but certainly that's a major area of emphasis. I think the one thing I'll prelude Dr. Bridgers talk with is giving a lot of credit to our Department of Health and Human Services and our Montgomery County Fire Rescue Services for the efforts they're undertaking with vaccinations right now. We are getting through the vaccine that we receive every week. Almost entirely, I think 98% last week is where we ended up. So we continue to encourage the state to provide Montgomery County more because if you look at the state's website, many other jurisdictions are not getting it out nearly as efficiently as we are here in Montgomery County. And so we know that we have a large population. We know we have a lot of people who are at high risk. And so we've made the commitment to get the vaccine out as fast as we can. But honestly, the bottleneck right now is the amount of vaccine that's being provided to us by the state. So I'm going to go ahead and stop there because I think obviously people are here to hear from Dr. Bridgers and not me. So.
Good evening, Dr. Stoddard, Mr. Willer, and all assembled this evening. Thank you for allowing me the opportunity to give yet another update to this body. But let me just back up and Dr. Stoddard stand by because emergency management and homeland security, just like fire and rescue, is going to come in and help with some vaccinations later on. So thank you for offering the support because we need the community inclusive to help us get shots and folks on. But before I launch into the presentation, and hopefully Adrian, I can share my screen or you allow me right from my side to share the screen of the presentation for our vaccine efforts. I just want to back up and remind folks, we're still in a post-holiday surge. Our 7-day test positivity rate is 7.1. Our hospitals, for the hospitals are at capacity for their ICU vacancies. And we need to be vigilant and mindful that while we look towards getting vaccinated, we are still much in the fight to keep our test levels high to suppress the virus, doing those things that have gotten us thus far, such as wearing face covers, washing our hands frequently, limiting our interactions with large crowds, and trying to, if we have to be in a crowd, being in a well-ventilated area. That's going to help us stop the spread of the transmission of the virus. And so having said that, I'll launch right into the presentation, if I may.
Dr. Bridgers, I think you have the ability to share your slides, but let us know if you don't.
Great, thank you. Let me just try to find it here. My apologies, I just had it open, so give me a minute. And so as Dr. Stoddard said, we've received our vaccines for so currently we're still in our category 1A prioritization and the tierings, and I'll get, as I go further down the presentation, I'll give a graphical representation of those priority areas, priority area 1A, 1B, 1C, and then those sub tiers within tier 1, tier 2, tier 3, and so forth in one priority 1B and 1C. And we're pretty much in to our tier 1 and 2. The hospitals and assisted living facilities, our rest and rehabilitative centers, our developmental disability agencies, and our assisted living facilities all received their doses of the coronavirus vaccine, the Pfizer vaccine specifically, from the Maryland Department of Health. And that's a partnership that they have. It's independent of the doses that we receive at the health department, and our doses are the Moderna vaccine. And so, as you see, we have a population to vaccinate of over 1 million folks, and we are only 2% statewide have received the vaccine. And so, of those administered, Montgomery County still ranks #1 out of all the other 24 jurisdictions with the amount of vaccines that we receive. And so we receive, the numbers will come up, but as Dr. Stoddard said, of those amount of vaccines that we received, 98% of the vaccines as of last night have been put into the arms based on those priority and tiering processes. And so let me just move my screen down some. And so as you see, 98% of those doses I indicated before. We received 6,900 doses yesterday mid-morning, which enabled us to expand our vaccinations into public safety agencies. And those public safety agencies were fire and rescue, emergency management, 911 dispatchers, our police in county and municipalities, as well as detention center staff. And so with the 6,900 that we received last night, we've received 19,800 doses, the most of any county in the state of Maryland. And we don't know what our expected delivery is for next week. We put in a specific amount, and we're given based on what the state has allotted for our county based on their distribution algorithm. And so we've had vaccine clinics at White Oak Recreation Center, Up County Recreation Center, Germantown Recreation Center, our Public Safety Training Academy, and now Quince Orchard, which will occur tomorrow and Friday. And so our current capacity based on the amount of vaccines that we are allocated each week, our current capacity based on those vaccination pods that I have illustrated here, that's geographically represented throughout the county, allows us to vaccinate between 2,500 to 3,500 individuals, including healthcare professionals, those individuals who've been in the COVID-19 response. We've opened it up to our testing partners and our urgent care and primary care doctors. As I indicated before, we're now moving into 1A Tier 3, which includes our dental practices, pharmacists, and other healthcare professionals. But we need support, and fire and rescue is doing a huge lift as we aggressively move through our 1A category and those 3 tiers under 1A before we can get to our 1B category. And so again, we've administered based on the doses that we've received as of yesterday, which is at 19,000 limit, 63% based on that capacity and that addition. But it still allows us to be the highest county to administer the doses based on the highest county out of the 24 to receive the most doses. And versus the state of Maryland, we've administered more shots than the entire state of Maryland, which is at 36% based on the vaccination summaries that we receive on a daily basis. Now keep in mind the data that we receive lags in the reporting because the state systems, the PrepMod station, the PrepMod system that allows us to schedule appointments, and the Immunet system, which allows us as a provider to receive the vaccine lags in about a day's data worth. So it may be a slight variation in the numbers as it's reported and as we update our slides daily. So this is a representation of the hospital vaccines that have been administered. We've been in discussions with the hospital, recognizing that they may not have used all of their Pfizer allotted doses. And so in order, again, for us to move progressively through the vaccination prioritization pyramid, if you will, or the tiering process, we've solicited support from the hospitals as providers to identify spaces and places for us to increase our capacity to get more doses or shots in county's arms. And so this is the group 1A, tier 1, which are the hospital personnel, the long-term care facility, the developmental disability and group homes. All these, as I indicated before, are through the CDC, CVS, MDH pharmacy partnership that affords them the allotment versus our allotment of the Moderna vaccine that comes directly to the local health department. Tier 2, which is what we're currently moving through. Tier 1A, tier 2, which is our EMS and our vaccinators and our testing site and our on-site registration staff, those folks who are frequently in the county and are at greater risk for community exposure. And so Fire and Rescue is helping further us to progress along the 1A tier 2 process. Tier 3, which is a heavy lift, and we hope that Fire and Rescue can continue to support tier 3, which is what they're doing now, which includes funeral home staff, surgical centers, our school nurses, our homeless shelter staff, our lab workers, etc. And then once they help us with this group and serving as vaccinators, then we anticipate that they will help us with other groups along the tiering process or in the categorical processes. 1B is our older age adults, 75 and older, public transportation, teachers and support staff, child care workers, grocery store workers, postal service workers, and our food and agricultural workers. Now, as I go through each slide, please know that we are thinking ahead prior to getting to a tier. So when we are looking at our adults age 75 and older, we are thinking about planning processes for them that allow equity, that's equitable, that allows access, and that allows a cultural appropriateness so that we can reach all of the populations with our vaccines. We're having conversations with our Minority Health Initiative partners. We're having conversations with our chief equity officer. And so we're looking at broadening our capability to reach all folks and to get the vaccines in folks' arms. But again, the key here is to have the amount of vaccines to be able to vaccinate more folks. We're also looking at other partners such as Kaiser Permanente to serve as a vaccine space, as well as the Food and Drug Administration to help not only provide the doses that they can support our vaccine strategy, but also vaccinating those folks so that we can get more clinicians to help our effort. And this is priority group 1C. So looking at the timeline and the requests and keep in mind that I said that much of our effort to date is dose dependent. We received our first doses on December 23rd, our second doses on December 29th, our third batch of doses of 8,600, and then yesterday 6,800. And so we're starting to see those individuals who received that first dose on December 23rd. We received the allotment for that, and the anticipation is that for the doses, while we don't know what we receive on January 27th, we expect to receive the 4,200 doses to administer the second vaccine to those individuals that received the vaccination on December 29th. That's the current plan. That's our capacity. I'll stop sharing now, and I'll open it up for questions if there are any questions.
One thing I would note just before, because I think it's really important, one of the big things that's being worked on right now is a portal to start getting the older adults, particularly the 1B tier 1, into, just submitting information so that we know of interest. And I think one of the big things about that is we know that there's a big digital literacy and digital access issue amongst our seniors. And so we're going to be looking to set up a system where people can actually call and have others get them into the system as well, so that's not relying on them being able to, access the internet or do anything like that. So those things are being worked on, and hopefully we'll have something in place. I think we're planning to try to have something by the end of next week, but I think that's sort of the goal. And in preparation for when we do get to at least the age 75 and older. And so I think it's a big thing. No, I'm sure someone would bring it up. So.
Sure, and just to add to that, we know that as Dr. Stoddard indicated that there are challenges throughout all of our testing groups as far as folks getting out or having access, transportation, et cetera. We're working on that. We're working with our aging and disability services to identify those populations that are at greater risk or have greater needs. We're also coordinating a call center for those senior individuals who may not have the capability or access to a registration mechanism to be able to support their needs to schedule appointments. So we are looking fortuitously ahead to look at all the populations as we go through and we continue to vaccinate. I know it was an immediate question in the chat box. I don't have all the numbers before me. I know some of the numbers, such as the aging population for 65 above and 75 above is around 200,000 individuals. Fire and rescue for their staff and public safety officers are around 7,000 individuals, but I don't have all the numbers in my head right now to kind of verbatim and to iteratively go through each category to know how many we have. I know for the primary providers who filled out a survey, we received information from about 50 to 60,000 providers.
Do those who are seniors, like maybe belong to Kaiser, do they register through the county or do they go through Kaiser?
That's a great question, Mr. Ricks. I just received notification that Kaiser had authorization to administer the vaccine. Prior to that, we are in the process of entering to a memorandum of understanding. Kaiser was one of the provider partners that we've been discussing them supporting our vaccination priorities. And so I would follow up if you have Kaiser as a healthcare provider right now until we enter the MOU with them. Individuals in that age group of 75 and older or 65 and up could contact the health department, go online and fill out the information that Dr. Stoddard and his team had put together to receive notification when the vaccines are available for a particular tier group, and would receive notification out. If Kaiser sends out something different, that's independent of what we're doing now.
Okay.
I think the big thing to realize is we really want the private providers like Kaiser to get access to the vaccine. That permission for access is going to have to come from the Maryland Department of Health. We can't give them access per se. Now, we are working on an MOU with them where we would get the vaccine and hand it across to them. And I think that's what Dr. Bridges is referring to. We'd like to have that in place, but and hopefully we'll have that in place over the next couple of weeks. But that would be largely to vaccinate other healthcare providers, not necessarily give it out as the primary provider for other, like for seniors, for example. Right now, the expectation from the state is to go through the local health departments to be doing vaccination for seniors. And obviously, there's a large number of seniors that get over the age of 60 is about 100 or over the age of 65 is like 160,000 Montgomery County residents or so.
Right.
We'd really like for that to go through the private healthcare provider network if it can.
I got information that DC Kaiser is already setting up appointments with people to give them the vaccination.
Yeah. DC operates a little bit more like a state health department. We very much would like for Maryland Department of Health to allow the same thing. And we're trying to do a little bit of a workaround with the MOU with them, but really what DC is doing, I think is something we'd like to see replicated in the state of Maryland. But that would require, because of the way it's set up with the state health department, the state would have to approve that in Maryland.
And that's correct. And just to add to what Dr. Stoddard responded to with Kaiser, so the memorandum of understanding that we've crafted out of the office or in collaboration with our office of the county attorney is mirroring what Kaiser is doing in DC and what Kaiser has supported in Prince George's County. And so prior to us receiving notification that they are now authorized to receive their own doses of allotment of the vaccine, we were entering into a memorandum of understanding for them to support our effort by serving as clinical staff vaccinators so that we would provide the doses to them in collaboration so that they can vaccinate individuals that we've identified or clustered in those grouping processes. And so now that they have their vaccines, we're still entering that agreement. We just need to follow up and see exactly what the plan is, whether or not they will have their clients, patients go directly to them, or would they come to us? So we're still working through the mechanics of that.
We've got a ton of questions in the chat box here. I'm trying to keep up with some of them. Have you considered a group call like politicians carry out to seniors if they register with their senior complexes so that you could get their phone numbers or they could get 311 information together?
So that's a great question. So a couple of strategies that we've talked about the last couple of days. Again, we're working with our aging and disability service area within Health and Human Services to help identify those seniors, where they reside, their zip codes, because again, some of the targeting strategies that we have, we still need to keep in mind of those highly impacted zip codes that we identified through our testing initiative, and to try to get the individuals who are at risk or who are at greater risk vaccinated. We're also looking at those individuals. Just the last couple of days, I think this morning, we talked about searching our databases to gather a listing of individuals. So as we begin to pre-plan or continue our planning and to identify those various populations that we're moving to see if we have some information and data to assist us with identifying those groups of individuals. So we have a couple of targeting strategies that we're putting in place now. We're collaborating with our agency, our Aging and Disability Services.
Is there anticipated start time for when 1B vaccinations will begin?
Another great question. We anticipate realistically 2 to 3 weeks. Again, it's dose dependent. If we get more doses, we're able to increase our capacity, bring in our partners, Kaiser, FDA, hospitals. Ideally, as Dr. Stoddard indicated before I started my presentation, we would love to get the vaccines to have private providers, public providers, have the vaccines in their offices so that individuals who have access to those providers can get a vaccination through them. We're hoping that that will come sooner rather than later, especially if the state of Maryland releases more doses to the local level health departments. And so we anticipate that it's still a couple of weeks off, but we are working very diligently to get folks vaccinated in those 1A categories along those tiers?
We estimate that 1A Tier 3 has roughly 30 to 40,000 providers in it. And so we're really just getting into that starting, tail end of this week, moving into next week. I will note, though, that I think the other big thing that Dr. Bridges correctly mentioned, that the state giving us the vaccine is the biggest determiner. But also, I think we should all be honest about the fact that of those 30 to 40,000 providers, some percentage of those providers are not going to be interested in getting the vaccine right away. And so we don't necessarily think it will be 30 to 40,000 people. We're encountering, even in our hospital settings, that some percentage of the hospital networks are not interested in the vaccine at this point. Now, that's not necessarily to be unexpected. There are some people who are never going to want to get it. There's some people who are just going to see others get it before they get it. And so it just sort of staggers it out. But as I think, the governor's previously alluded to this, we've actually been talking about it as well before the governor alluded to it, is we're going to definitely use the Southwest model for, the way they do boarding, which is you start with a category. As soon as that line starts to dwindle, before the last person's gotten through the line, you're already queuing up the next group and getting them in. We're not going to wait until healthcare providers are all the way finished to start getting into seniors. But what that does mean, I think everyone should understand this, is that in the very first week when we do integrate seniors, it will be seniors as well as healthcare providers. So it'll look like we got a lot less appointments than we actually have, because it'll be seniors applying, getting whatever percentage of slots are available, and healthcare providers taking up some slots. But as healthcare providers come off and seniors come up, you're going to see more availability for seniors. So I think just people shouldn't be alarmed the first week that's, we add in the 75 and older group that, there's only 300 slots or 500 or 1,000 slots, whatever it ends up being. That's just because we're filling up the slots that are not being filled by the healthcare providers. And as the healthcare providers do less, seniors will come on more.
Thanks for that, Earl. Any reports of any severe allergic reactions thus far locally?
Not to my knowledge. Dr. Stoddard, have you heard anything?
No. So here, the rate of anaphylaxis, because there's actually a University of Maryland meeting that one of our staff members was participating in. Rate of anaphylaxis being the most severe consequence that typically happens from vaccination, is about 1 in 100,000. With 1 million people in Montgomery County, we expect, in the area of 10 of those. But just to be clear, anaphylaxis does not mean death. We have EpiPens on site, and we do the sort of wait and monitor folks. So typically those that you give someone an EpiPen, and they're largely they end up fine. Sometimes we haven't had, but across the country there have been a few instances of people going to hospitals for a little bit of a waiting period, but then being released. There's been no fatalities related to the vaccine. I think, to be crystal clear, getting COVID is not any walk in the park either. So we know that people are dying of COVID. We know that people are having severe infections. And so in a world where, COVID's not going away, the vaccine offers us the best opportunity with the least risk to get people off. And so just so everyone knows, let's see, can y'all see that? There's my Band-Aid from 1 o'clock today. So I feel fine. I'm on this call. Obviously, I worked out today, so I've no soreness at all. No issues at all. So I certainly didn't have any problems. We have heard, just to be totally honest, a few people have said that they feel a little bit worse after the second dose than they do after the first. We haven't had many second doses in Montgomery County yet, because we're just getting the first doses. And what I mean second doses, that people are feeling a little more lethargic and maybe a little bit more fever. But that's really just your body mounting an immune response, which frankly tells you that the vaccine is working. So I think I would find, you wouldn't love it in the moment, but I think I'd find it a little bit relieving that my body was mounting an immune response to the vaccine, which tells you that it's going to mount the immune response if you're exposed to COVID.
And so just to add that, I know that I've been to 6 or 7 sites, and some of the challenges I know that folks have around getting the vaccine and being a little anxious, that's not an anaphylactic reaction, but that is a mental challenge that some folks have shared with us, and it's a real phenomenon. And so, as Dr. Stoddard just indicated, He didn't have any adverse reaction. And so if you get the notification, please, I implore you to get vaccinated. Typically, what we've been doing is we have a scheduled set amount of appointments. And if those individual appointments aren't filled, we will open it up to a wait list based on the tiering processing or the grouping process. And so while you don't lose the opportunity to get vaccinated, what we're finding is when we project numbers and we have to have doses available, some folks don't show up. And so if there are any concerns, we ask that you have a conversation with your primary care physician prior to getting the vaccine when it comes to your category and grouping. And I know our comms team is working very diligently with infographics, with messaging, with information to provide the best method and approach for individuals to receive the vaccine.
Thanks for that. I do want to add as well too, I have a son going on 22 years old who got his vaccination a few weeks back. He works at Suburban Hospital. Everything appears to be okay. He's still getting on my nerves in the same way that he always has, eating all the food up out of the house without contributing whatsoever to the groceries. So I'm keeping a close eye on him to see if any of this changes. I will report back to you all and let you know if I notice anything differently. Thus far, I haven't. A comment in the chat was around why the state itself is not assisting in helping set up a portal around pre-registration for folks here.
So each jurisdiction provided their plan to the state back in October. And so afterwards, the plans were reviewed by the Maryland Department of Health, and each local jurisdiction, once the Maryland Association of County Health Officers agreed upon the prioritization, tiering, and grouping process, they are responsible for implementing and initiating their plans based on the doses that the Maryland Department of Health provides to them. Maryland provides the guidance, and if there are any challenges or questions at the local level, they provide the guidance based on the interpretation of policies and information provided by the Centers for Disease Control and Prevention and the Advisory Committee on Immunization Protocol, which set the prioritization pyramid, if you will. But basically, the locals, once they develop the plans, are responsible for implementing their plan and evaluating and adjusting their plans as necessary. As a repeated message has been on this call tonight, this meeting tonight, is that it has been dose dependent thus far. The more doses we get, the more folks we're able to vaccinate and move progressively through the tiering process, 1A and then 1B, but we can't move from 1B, tier 1, 2, and 3 without enough doses to get to 1B.
I would just say, I think, and a little bit to the point, the other point of the question is, I think I don't like to be critical of the state all the time, and it comes across as if we are critical all the time. I think it would have been helpful for the state to have developed a registration system, pre-registration system for all different categories. I don't think there's any question about that. What they do have the PrepMod system, which for those who don't know is actually the site where you actually do register to receive the vaccine. And the site, while it has some challenges, and people say it has too many questions, it works pretty well, and it does get you to the right place, and it does collect some really important demographic data around race, ethnicity, underlying health conditions, and it is fairly successful. It is not really designed to distinguish out which tier and whether we're in the tier that allows you to actually register. And so, as many of you may have seen, there have been some hospital sites or links that have been leaked out, and people have tried to register, and then the hospitals have having email all the people who registered who aren't healthcare providers and let them know, hey, it's not your time to come register. That tool is the tool that's set up for the PrepMod system that is being utilized to get registrations is not really great for appreciating that there are different peoples in different categories and who's eligible and who's not. And so I think if we knew then what we know now, I think a reservation system would have made a lot of sense for the state, because of what's going to end up happening is that every county across the state is going to end up having to create their own version of this that looks a little bit different. And I'm sure you'll find jurisdictions, we're trying very hard to prevent this, whose sites will crash when they launch them, who they'll end up maybe not collecting the data that they should have collected at the beginning. So we're going to learn some lessons. It's still, it is still an emergency event. I want to be fair to the state where we can be. We're going to learn, we're going to make mistakes. We as a county will make mistakes. The state will make mistakes. The federal government is making its more than fair share of its mistakes as well. And so we're going to try and make it work the best we can. But, I think we all recognize that it would probably been helpful a couple months ago to have a early registration site and getting people into it.
Sure. And I would agree. And I know that Dr. Stoddard and I and others have talked about lessons learned. We don't want to recreate the registration breakdown in Florida or Texas or any of those other places that use an Eventbrite mechanism, and anybody could register, and you had a flood of folks who weren't able to get a vaccine or waited in an astronomically long line to receive a vaccine. And so part of that, let me be clear, I am not attempting to bash the state in any way. The state has partnered very collaboratively with us. It's just that the doses that we receive in some regards are not meeting our current demand to handle our capacity. We would like to vaccinate more, and we would like to do more from a public health perspective. And that's challenging and realistically frustrating when we know that folks want to get vaccinated, and we're working in all avenues to get the doses, to plan properly, to collaborate with our partners, to make sure that it's fair, it's equitable, and it's accessible.
Thanks for that, Dr. Bridges. Where do teachers fall in the tier of being vaccinated? Is there any conversation around them being vaccinated so that we can get back to opening schools up sooner?
Sure. So I know that Dr. Stoddard and Dr. Gales have been in many conversations, but we are looking at once the Fire and Rescue has supported the public safety, providing support to our public safety vaccination process, we hope that we can get our teachers vaccinated. I know that there's about, Dr. Stoddard, is at 24,000 individuals who in MCPS who need to get vaccinated. And so we're working with MCPS to identify those folks and staff as well, so that we recognize that we want to get teachers vaccinated, and so we could get schools open, and so we could get back to some sense of normalcy. And so that's pretty much all I'm aware of in the conversations that I've been in. But we're looking at teachers being in 1B, the lower part of, 1A, tier 2, I believe.
1B, tier 2 is technically where educators fall. Right. Dr. Bridges is correct, 24,000. We've actually been working with MCPS and asked them to prioritize, because obviously 24,000 is a big block, and they've already begun to identify at least 2 pools of their staff that are going to be prioritized. Number one, those people are doing the food distributions through the school systems right now, because obviously that's a ongoing interface that is providing a key service. And number two, their phase 1 of their reopening plan, faculty and staff who are needed for that process. And so they've already begun to identify the names of people on that list, and we'll get, they'll basically, as we need to know how much doses we'll have and when we'll be able to schedule, but our goal is certainly, I think we know March 15th at this point is the next time frame. I think we would like to ideally start getting them vaccinated by the first week of February, so that we could have them through both doses before that March 15th deadline. And, hopefully at least a week in advance of that March 15th deadline for most, because then that would give them the necessary immunity. I think that's certainly where we're hoping to be. Obviously, that's dependent on us getting the doses of vaccine that we're going to continue to request from the state of Maryland. And I think we're also, just so everyone's clear, we're going to be meeting with our private school providers. We're actually setting up a meeting for the 29th with our private school providers. We started working through that today so that we can give them that same information, have them prioritized, so we can hopefully start with them around the same time as our public school system, hopefully. So.
And part of that collaboration, I mentioned that Quince Orchard High School is one of our vaccination point of distribution pods for the vaccine. We've identified other schools throughout Montgomery County where that we could geographically provide greater access in various spaces, and so we are waiting for those available spaces to come online so that as we vaccinate our educators, we can have greater access for them as well.
Is there a comprehensive strategy that the county is undertaking as in terms of communicating and marketing when it comes to the vaccine? Anything, misconceptions that may be out there specifically in communities of color or communities that speak Spanish first, anything like that? Where's the best social media site to go get access to information, perhaps in different languages?
So I know our comms team is putting together a very diverse portfolio, if you will, of infographics and public services announcement. I know that they could be found on the county's website. When I looked this afternoon or in discussions, I don't think that they've been a full launch. I know that that's where you could find information. Pretty much, if you go to the Montgomery County COVID page, there are a lot of links there to provide information. And so we have a diverse team to look at access, cross-cultural access and information. And so there's a town hall next Tuesday, I believe the 19th, that the council members are hosting. Is bilingual, and it will have similar information about the comprehensive plan for the county and reaching a wide reach and in diverse populations. So that's next Tuesday. But the comms team is putting together a very robust media and information platform.
I'll say a few things too, and I'm certainly, I see Julie is on the call and she's texting, so she can chime in if she wants to.
Yeah, I didn't want to call Julie out. I saw her profile down there.
She's texting, so I know she's there. So first off, we have if you go to the website that was just linked by Julie in the chat, we have a sign-up system for an alert where you can either by text or email receive alerts. We sent it on the first or yesterday. It was a little bit rocky, but in the future we're going to do it both. It'll be both in English and Spanish, so that you'll get, when we send an alert out, you'll get it in both languages. We also have as part of the team, everything on the website, the vaccine website's already available in 7 languages. It'll also the priority groups, that page I think is in the process of being translated to as well. Our goal is to have all the vaccine information available in multiple languages, including the survey that we ultimately develop to collect information about our senior populations, then expand that to other populations as well. We are working with our health initiatives, so both the Latino health initiatives, the African American Health Partnership, the Asian American Health Initiative, to get information out to various groups. The county has a Spanish WhatsApp page where we're putting out vaccine information as well. And so I won't say that we're perfect. We're always looking for more opportunities to get information into the hands of and the hubs. The hubs are going to be a big distribution source. As I think was noted with rental assistance, we know that people are coming in for food assistance are also going to be large, will also often likely fall into the priority groups as well. And so we'll be using those other interfaces as opportunities to both let people know about the vaccine and ultimately, once the page is ready, get them pre-registered in to receive information about when their tier comes up. Julie, I don't know if you have anything else to add there.
I think both Dr. Bridgers and Dr. Stoddard did a great job sharing with you all, but I would ask, if you take a look at the link in the chat, one of the first things you'll see on that link is the box where you can sign up. So at this point, we have more than 35,000 people in the county signed up to get these vaccine updates. Just to be very clear, if you sign up for it, you're not signing up to get a vaccine. We're not there yet. You're signing up to get news about the vaccine. And one easy way you can all help is through whatever email distribution lists you have. If you're on Twitter, LinkedIn, Facebook, whatever it is, please share that link and encourage everyone to sign up for these updates. And then as soon as we do get to a place where we have an actual vaccine pre-registration link, then those folks will be getting these updates. And I think what's very beneficial about having something like this is most of us regular people who are waiting to get vaccinated, all we can do is wait. But if you give people the opportunity to do something, such as either sign up for the update link or eventually sign up for a pre-registration link, you're giving residents something that they can do. And so I think people do appreciate that. We have updated the vaccine page, the web page, and the feedback's been pretty remarkable. And if you take a look at the page itself, and there's something on there that you think is glaringly missing, or you would love XYZ, again, my county email is julie.parker@montgomerycountymd.gov. And I work very closely with the woman who is doing the actual website updates, and would be very appreciative of your feedback, whether it's good or if you have something constructive to share.
I have a quick question on the language component. You mentioned English and Spanish. Is there any way to get other languages? I'm thinking of Mark amongst others. I don't know exactly the program they use, but I know that when MCPS sends out a message, it's able to be clicked on like almost 8 different languages. You can instantly click on, and it's Spanish, Amharic, things like that. Is there any way to do something similar to that so that you're using more languages?
Yes, so if you look at the link that's in the chat, at the top, there's a blue box with multiple languages. I will say that our translation team, Earl mentioned that it was a little bit of a rocky start. We were editing the page that you see, the information about the amount of vaccines until 11 o'clock last night. So that was our first one. We all know how the first ones go. So now we've got our template. We're ready for next week, where hopefully early Tuesday morning, the next update goes out. And hopefully that allows the translation team time to catch up with their backlog of work. But for next week's update, because the template is now in place, certainly for Spanish, it's just plug and play. We're just going to change out the numbers. So fingers crossed that that is a smooth launch as of next week in Spanish on the vaccine update. The entire page, you should see that there's the ability for multiple languages. I can't say specifically where the translation team is in the process. They've got it, but they've got a lot of work to do.
Yeah, are there ways that I guess, so I saw on the page you have the multiple languages, but it sounds like the updates are only going out in English and Spanish, and not the updates aren't going in different languages?
Correct.
Because that's the thing I'm thinking of as well, is that if there are ways that those updates can go out also in multiple languages, or how, because if somebody isn't going to know to go to the website to see an update, and if they're clicking on something to get an update and it's not in a language they can understand, that makes it even more challenging.
I'm not a delivery specialist, but I believe that you can only put all of the languages in one message. So let's say, we did English last night, and then you add Spanish, and then you add 6 more. Earl is better at this than I am. From a logistics standpoint, I don't know.
And I don't, and that's why I don't know all the details, but I know that when Montgomery County Public Schools sends out a message to parents, within whatever platform they're using, within the message itself, you can click on, just like the website's set up, where you can click on different, you can do that within text messages that are going out. I mean, it's through a link. So a text message would go out and say, click here for more information about Montgomery County Public Schools. You click on the link, and then you're able to get the message in multiple languages. So I don't want to spend too much time on it, but I do think it's important that as people are getting the updates and the messages sent to them, that they're able to get those in as many languages as possible.
Take a look at it, and obviously we have MCPS on a lot of our work groups, so we'll take a look at it. I'm going to guess they probably use a Google Translate or some other tool to do it, which we certainly can look at. The only some of the challenges we do, you know, in my office, we do a lot of emergency alerting, and some of the things that we have is that, you know, sometimes while Google Translate can be good in some messages, it can not be as good in other messages. And so we'll have to take a look at what tool they're utilizing and figure out, because obviously this is not quite the same as an emergency alert where it's like we're typing in real time and sending in real time, and therefore we're beholden to whatever the translation is. We can actually probably see if Google Translate could work in this case and test the message and see whether it would work. I think it's a reasonable thing for us to take a look at, and we will.
Okay, thank you.
Thanks, John.
Is there any expectation that, you know, a week from now, things will improve drastically with the new administration in place?
That's a great question. We hope so.
Yeah,
we don't know.
We don't know. I don't want to give a really lengthy answer, but there's every reason to believe that things will change. I expect they're going to stop holding back second doses and start pushing everything else as the first dose. I think the Trump administration has already sort of latched onto that, and then we'll be starting that. But the other big thing is the hospitals in the state of Maryland have gotten, or I think as of Monday, had gotten about 60% of the doses that the state had received. Obviously, the hospital systems are going to be finishing up or at least tapering down their need. And so a lot of those vaccines will get transitioned into other places, for example, either at the local health department level or maybe through the private healthcare system. And so I think as we finish up large groups like the hospital system and transition those doses out, other areas see a large increase as well. So we're hopeful that will happen as well. Not to mention, I think we're hopeful that, you know, the EUA for AstraZeneca will be submitted over the next week or two. It's already being used in the UK, and so that would give us a third vaccine option to utilize with additional production as well. And so, you know, everyone's like, well, it's going to take us, you know, 2 years to complete our current pace is not where we will be in a month. I think that's pretty clear. We just don't really know how the ramp up's going to go. We're not concerned in a good way, just so we can respond to it. You know, we're getting 6,900 doses this week. If we got, you know, we'd love to hear that we're getting 15 or 20,000 next week, but that would just be a challenge for us to have to get them out the door at that point.
So speaking of that second dose, does the county have a position on whether or not we should be withholding that second dose in order to get that first dose out in a larger tranche?
We're not holding any doses.
Yeah, I mean, I think we're kind of following the science of this pretty close. I think there's good reason to believe that we should be giving out first doses, as, you know, delaying second doses if we have to for first doses. But we're gonna be consistent with the rest of the state, because I think the worst case scenario is we start the rest of the state and region too. I don't think we want to be doing something that's very different from everyone else around us, because that just leads to public confusion, and we don't want that. We don't, you know, we wouldn't want people to, well, Montgomery County is not giving a second dose, we're going to try to go down to, you know, Fairfax County and get a second dose. So I think that we're going to try and be consistent across the region and state to the extent that we can.
Is the state holding on to vaccines as we currently speak?
No, the state.
I don't think so.
Yeah, no. The state shows that they distribute. Yeah, the state gets them out. But for example, I think as of, when was it, Monday, there's been roughly 200,000 doses distributed to the hospitals, and I think they've only put 100,000 or so into arms. So there's vaccine in freezers. I don't think it's the state necessarily. It's not us as well. But there are some cases where both the hospital systems and the federal contract through CVS and Walgreens with the nursing homes needs to move a little faster.
Right. And I think one of the questions along those lines was for those congregate living spaces, those assisted living facilities, long-term care facilities and rest and rehabilitation centers, CVS or Walgreens is providing the doses to them. So we have no control over, from a local perspective, the dose that we receive are exclusive from what the hospitals and the pharmacies receive in that partnership with the state.
Appreciate that. And speaking of refrigeration, is there going to be assistance provided for providers who don't meet refrigeration requirements of holding on to the vaccine? Will that assistance be available? How does that work?
So Earl, you got any comments about that? I know from my understanding is that we were guided not to purchase any refrigerators. So at the local health department, we won't have any capacity to store any of the Pfizer vaccine. The Moderna vaccine is controlled in our storage and kept. I don't know the capacity as far as will we have the ability to store and distribute more doses than we actually vaccinate in partnership. So again, we're looking at the providers. If they don't have the capacity, then we would have to assess that on a case-by-case basis, I would say, unless there's some other means of support.
The National Guard has the -80 freezers as well, and Dr. Bridges is I think it's worth reiterating what he said. We were told not to purchase them at the local level because they're going to provide them at the state level. We are looking at partnerships with the hospitals to do community clinics around the hospitals that will allow us to leverage their freezers for the Pfizer vaccine over the long run. And so I think that private providers are likely to be provided is the Moderna and ultimately AstraZeneca vaccines, which don't require the deep freeze that the Pfizer vaccine does. And so I think we'll utilize the doses in the way that makes sense. Obviously, the local health departments are going to be engaged in vaccine distribution, and therefore, if we partner with the hospitals, we can take on that -80 through that partnership with the hospitals, whereas the private providers will get the other vaccines that are allowed that can be stored at the more reasonable freezer temperatures.
Fair enough. What is testing looking like right now in the county? What's the average weight? I know that we had a huge number, or I would say backup around the holidays because of the number of people who chose to travel out of town or to congregate with others. But currently, what does the testing wait time look like?
So the current testing turnaround time that we've seen, I think from the report as recent as yesterday, is around 2 to 3 days with our labs. If it goes to an extra day, there may be some challenge with the specimen provided or with the registration process, but we're seeing a faster turnaround. We've worked very diligently with the labs, and we've had independent conversations. The labs that we've used have brought on more staff to enhance their operations. I know that post-holiday, they were literally operating a 24-hour system where they would, once the specimen is collected and resulted, we were seeing notifications as early as 24 to 36 hours. And so we worked very, very diligently with that. We have a Microsoft system interface online so that individuals can receive a text message where they would go into the portal and provide their information and get a text message. Now, if someone is traveling, depending on the airline, they could show that text message with the results on there if they have the capability from the lab. But we're testing more. We've tested, we tested last week over 25 spaces, and I see Pat on here. So thanks to AHP's initiative for helping us out, and our Salud, BNSSTAR, LHI initiative, and even our Asian American Health Initiative has done some testing in smaller capacities. So we're testing, we're meeting those suppression rates, but we still need folks to do their part by all of those things that I said before. And I won't go back over them, but wearing a face cover, washing your hands, and maintaining those social distances to prevent the transmission of the virus. And so the testing is there. The testing is there. And when we get our vaccines, we are ramping up to get to as many folks as we're doing this testing. I think last week we tested over maybe 15 to 17 1,000 people. So our test numbers are high. Unfortunately, our test positivity rate is also high. It's about 7.1, which is a medium risk for exposure based on the surveillance data that I received this afternoon.
And just to clear up some, go ahead, Dr.
No, go ahead. I saw something in the chat box about the UK variant B117. We haven't received any additional information from the Maryland Department of Health epidemiologists. Their messaging is to still do those same thing. My understanding is that the vaccines that are being administered will still work against that variant strain. The reproduction rate is around 1.4 to 1.7. So that means that the virus can spread almost twice as fast as the current strain. And that's about all we know, or that I know, that I'm aware of. Now, I don't know if Emergency Management and Homeland Security had received some additional information, but that's the information that was put out to the local health departments. And in Dr. Gales' absence, he did forward me that yesterday when I texted him that there was cases found in Anne Arundel County.
I think we're monitoring that variant. There also is this new variant that's been discovered in Brazil, which may have a vaccine escape capability. We're going to find out over the coming weeks. I don't want to alarm people, but that's being looked at. So yeah, we look at all these, and candidly, the longer COVID is allowed to circulate, the more these concerns get raised, which is why it is a race to get people vaccinated, and which is why we're pushing so hard to get people vaccinated as quickly as possible, because the longer you allow this pathogen to transmit in our population, the sooner it's going to adapt, and those adaptations will not be to our advantage, it will be to the viruses.
And just to clear up any misconception, testing is indeed free, correct?
Testing is indeed free.
You can come it's not free once, it's free every time. So if you need to come and get tested every other week, come and get tested every other week. You won't pay a single time.
We want you to get tested. If you have any hesitation about whether or not you need tests, I would err on the side of caution and get tested.
Definitely.
Especially if you are in the community a lot, or in closed spaces, or part of front facing, or if you frequent those individuals, or if you have those young adults that I affectionately call young Thundercats and Thunder Kittens, that if they're out in the community a lot and they reside in your household and you want to keep your household safe, I strongly encourage you to get tested and have them test frequently.
How did you all define who was at high risk and who deserved to fall into what tier specifically?
And so we work with the Maryland Department of Health, the Centers for Disease Control and Prevention, and the Advisory Committee on Immunization Protocol, ACIP, to determine those prioritization categories and those sub-tiers within those prioritization categories. We vetted those prioritizations and those sub-prioritizations and those identification of high-risk individuals. The Maryland Association of County Health Officers also met to discuss that. So that's how that was determined. And that's how we were able to identify those priority and those sub-prioritization levels.
Are there current projections as in terms of the number of people vaccinated by a certain date based on already available and manufactured vaccines, or are they taking into account any vaccine that may be coming into production and being released to the population?
So we're basing our capacity on what's currently available. I know that there are clinical trials still out there, and you have Johnson & Johnson, who I read a report on this afternoon, and I think it was released on the media. They have a dose that you could put in the refrigerator and doesn't take the same type of precautions as the Moderna and the Pfizer and the AstraZeneca that was used in the UK. They still need to go through the emergency use authorization process before they can be distributed in the United States. And so we're basing our current plans as we speak this evening on the Moderna vaccine that we received from the Maryland Department of Health.
if someone qualifies to get the vaccine under the first tranche or, tier 1A or what have you, but decides they want to wait later because maybe the doctor said, why don't you take some time and wait, let's see what happens. Are they still able to obtain the vaccine later when they're ready to?
Yes. Yes, they just follow up and send a request. They should receive the information, an email. They can reply to that email. It should come from C19 vaccination at Montgomery County, Maryland .gov. They can reply to that, and someone who responds to that email and monitors that email will validate that they actually receive notification to schedule an appointment, and they can reschedule it through that vehicle.
We're not going to wait for you, but we'll be ready when you want to come.
Correct.
Is our mantra.
Yep. Because we have to keep moving. We have to consistently keep getting folks vaccinated. And if your turn comes up for any reason, there's always an opportunity there. But we want to keep moving as to give other folks opportunities.
As you mentioned, and this is a question a lot of people asked in the chat, you mentioned some no-shows coming up. We've read in other states about vaccines expiring, and so they have to give them out to people right away. Has any of that happened in Montgomery County? And if that did happen, what would the process be if somebody had to immediately deal with the vaccines or they're going to go bad?
And so that's a great question, John. And so we've had a couple of instances, but they were very few doses. What we did was we brought the doses back to our Dennis Avenue Health Center, and there were some healthcare professionals there that used the doses. There were less than 10 doses. So one vial contains 10 doses. And for those partners who don't use it, they return it to us, and we try to use those doses within a timely manner. Usually early afternoon, we will know how many doses, but it's a very controlled environment. So if you will, if we are at a community pod, we have the doses in a time monitor, temperature monitor container. We only take one dose out at a particular station. As we see the appointments dwindling down or being reduced, we start to scale back the number of stations to handle and accommodate the number of appointments for that period. So that's the current plan, so that we can minimize the extra doses that may be open and unused, because we don't want to, we can't discard it. We're going to use them, but we try to minimize that to every extent possible.
Thank you.
Mm-hmm.
A question going back to the testing earlier, as in terms of the cost, it being free. Is that applicable to every site or only to Montgomery County sponsored sites?
I can only speak to Montgomery County, and for individuals in Montgomery County, we're not going to turn you away, because we know individuals work in Montgomery County. Individuals commute to and from Montgomery County. We ask that when you come, we aren't checking any IDs or anything. We take it upon your integrity that if you live or work in Montgomery County and you want to get tested at one of the Montgomery County sites, we will honor that.
You will see private providers charging.
Yeah.
Just so we're clear.
Yeah, but not in any of the
not at our sites, not the county sites. But if you go to an urgent care, you will be charged for it.
Yeah. And those rapid tests, they're charging for those rapid tests. I understand they're about $125 to get a rapid test. We don't have any rapid tests available for the community. And so we aren't providing any rapid tests. I didn't see the question, but I just wanted to put that out there, that we don't provide rapid testing under our current testing platform, nor do we provide the home-based testing kits. We have done some evaluations of some vendors to possibly have that capacity. And so we're working through that now. But the current test that we have, the molecular PCR test.
And do we know whether or not there will be distant? It's 8:40, folks. It's been over 12 hours.
That's all right, I understand.
So, I'm preaching to the choir here. Do we know whether or not there will be different testing or a different set of testing strategies for travelers, especially as airlines start perhaps testing folks before they board? Do we know that at this point?
No, again, I know that my son visited us, and I'm going to give a real-time example. He visited us, and he was staying in our house, and he got tested prior to coming in, and he got tested before going out because he had to have a valid test result to board on the plane. So he literally used his result that he received on the on his phone, and he was able to board Delta with that. So if in fact there's a need or a specific need, you can always call our COVID call center, and they may be able to provide additional information or some level of certification that can be emailed to you in an encrypted manner if you don't have access, or through one of provider networks, if you don't have access to an email. That may be something that can be done on a case-by-case basis through an encrypted process to protect personal health information.
Christy.
I have a quick question just about federal employees. Montgomery County is home of a very large population of federal employees, and I just wondered if Montgomery County Health Department has had any contact with federal agencies on getting feds vaccinated.
All right, Christy, great question. We haven't had any contact. The only contact we had was with the FDA to partner with us to help with vaccination. So we would vaccinate their clinical staff, and then we would identify staff to go to FDA and actually get their vaccination on site. There hasn't been any additional discussions on federal partnerships or vaccinating any federal staff through our current vaccination mechanism.
Well, I would clarify that if they fall into one of the priority groups, if they're a federal worker who is a clinician, they can submit through the survey. And I know factually, my wife is a federal employee. Her supervisor is a licensed medical provider, and she filled out the survey and she was vaccinated on Monday. So if they fall into a category, it's just not, their federal employment status is not going to be a special category as of right now. So if they fall into another priority group, whether they're over the age of 75 or ultimately 65, they have an underlying health condition, they're a medical provider, they are a social worker, they have, whatever other category they may be, they'll be eligible to come into our clinics for that purpose. But we're not currently even vaccinating for even our county employees. We're only vaccinating those people who, based on their job description, fall into one of the categories that, whether it's a public safety responder or a clinician or what have you.
Sure, and I think that includes federal law enforcement, because we had questions about that as well. So,
yeah, I'd love to follow up offline with you, Earl. I've been working on some of this in my day job, so I'll send you an email.
Sure.
Thanks. So just a point of clarification, the link that Julie shared earlier, will people be able to receive email notifications around when they'll be able to receive their vaccination if they sign up through the link?
Sorry, can you repeat that? I was reading the chat related to that.
Yeah, me too.
Yeah, the basic, the alerts are just to tell you what group is eligible. It's not a sign-up system to get your own vaccination. It's just general information.
Right, but when we get to the point of having a new, let's say next week we're going to launch an over 65 or over 75 survey, we'll include the survey link in the alert. So it'll say, if you're, here's where we're at. Oh, and by the way, we're now adding in age 75 and above. If you're interested in the vaccine, click on this link. And so it'll be done that way. It's just that the first alert, we're actually in tier 3. We've already been surveying people in that tier and collecting their information through the provider survey that's on our website now. And so we didn't include it in the first alert for that reason. Future, when we go to new tiers, it will include the link as we get into those new tiers for people expressing their interest. Or once we launch a new tier, even if, for example, if we have the alert next week, or if we have the link ready for 75 and older next week, in the alert we'll say, we're not quite into tier 1B yet, but go ahead and use this link to sign up in advance for if you're over the age of 75, for example. And so that the alert will include that kind of information.
Can I ask one more question about that? And I'm sorry if I missed it. I joined a little late. I had another meeting. But on that link, like, how do people know that they're supposed to go to that link or that they're supposed to sign up? I guess it seems like in order to get the vaccine, you have to go and figure out whether or not you're part of that category. I guess I'm curious about the communications and how that's being pushed out to employees and to people in the general public.
And so I'll start in the role, and Julie, you can add on to anything I'm saying. So at the website, there's a survey, and we're asking individual providers, individuals who have offices or who, based on those prioritization levels, to do a planning survey to tell us about your organization, how many people, what type of service provider you are, where you fall in that tiering process. We take that information, and based on those prioritization and tiering levels, we assess where individuals and when individuals should receive a link to schedule an appointment. Once those individuals in that particular category, based on that assessment, receives the link, they will have access to PrepMod, which is the appointment system. They will schedule an appointment for any particular days for whatever that week. Say it's this week and it's what's today? Wednesday, and it's Wednesday. It would be Tuesday, Wednesday, Thursday, and Friday for any of those places, if any of those appointments are available. And that's pretty much how we are vetting them. In some instances, we may follow up and say within a category, you have 10 people, but 3 of those people fall in a higher tier. And so we will ask those individuals in that higher tier to get an appointment. And as we go down, we will provide those appointments to those individuals in that agency. And that information is contained on the website, I think, where Julie posted the link to.
And as we approach different categories, for example, like childcare providers, we have a registered list of all the licensed childcare providers in Montgomery County. We'll utilize that list to send out information as we get close to that group. For those 75 and older, Dr. Bridges has already alluded to the fact that we're working with the Aging and Disabilities Division of HHS to identify where people are. Obviously, MCPS, the school, we're going to do a webinar for the private schools. Grocery store workers, we're actually working now to try and identify how will we reach out to those folks when it gets close. And so we're preemptively looking for the avenues through which we'll get that information out to specific groups. And then we're also going to do like the more public blasting. Obviously, it's hard for us to get to every single person in every single case. And so we'll be relying on our community partners who we are already engaging with to start to be able to disseminate some of this information for some of these groups. But again, as we said, if your turn comes up and you don't realize it right away, you'll still be able to sign up whenever you do realize it or you become aware of it. And so it will be an iterative process to keep trying to communicate to people where we're at, who's in that group, everything of that like. So we're going to do some specialized things as we get to specialized groups to try and really get to them. But we're doing weekly media briefings. We're doing the alert system. We're doing specific messages out to associations and other things of that nature. We're utilizing, in the case of, if you've done a test before, we're gonna be able to have your email address from that test and maybe utilize that to send out notification about vaccine doses, for example. So we're trying to use as many methods as we possibly can. It will not be perfect because we don't have, the megaphone that goes over the whole county that hits everyone at the same time, but we're gonna use as many different methods as we can to make people aware.
Julie, did you want to add anything?
I am busy dumping links into the chat. So I've got a Facebook post, a tweet, and I was going to search for where you can sign up for the county executives newsletters that come out once a week. And the newsletter has the most relevant news of the week. So right now, vaccines are at the top. And by the time you're adjourned, I'm going to find the link for you to sign up for that if you haven't already. And also Nextdoor is another place where we are sharing news about, got it? Pat is nodding her head, where we are sharing news about all sorts of things to include vaccines.
Thank you.
I just wanted to ask quickly, oh gosh, I have my work background up. I wanted to just ask about the how healthcare providers are being notified about, our healthcare providers being notified about what to tell their patients. Because I know my dad, who's 76, he'll be 77 in a few weeks, is, obviously he'll be in the next group to be eligible. He's very anxious to get that shot. And so he's got like an ongoing email communication with like 3 of his doctors, and he keeps forwarding me these emails and they're like, yeah, we don't really know. Like, we don't know what to tell you. We don't know what to tell you. And so like, I'm glad I'm on this call hearing it so I can tell him, but it feels like that's a huge disconnect, especially when so many seniors and other people who have, ongoing relationships with their own doctors rely on them for their health information.
So Bridget, that's a great question. So one of the things as far as the messaging process, again, as I referenced earlier on in the presentation, is that we're working with our aging and disability services so that we can convey the most appropriate messages across diverse communities. So we can say, hey, if your health provider hasn't explained this to you, then there may be something that we can explain, not trying to serve as a substitute, but additional medium to provide more education. So if there's some challenges that individuals are sharing or are experiencing, we will take that in consideration as we prioritize and move into those other categories. We don't go against any healthcare providers' guidance or any advice that they are providing. What we do is we try to offer our best approach to understand and allowing access for that individual to make it understandable so that they can feel comfortable when it's their time to receive a vaccine.
We also work with the medical society too, which is obviously a constellation of providers. And, actually we were on a call on, I don't even know what's today, Wednesday, Monday, was it, James? Where we were meeting with
Monday and Tuesday.
Yeah, well, I was gonna say, I think you met with them both days, right? I think I was on the call on Monday, where we're definitely trying to get more information out through the provider network. I know that Dr. Gales, who he's on leave this week, or working mostly remotely, but he does have pretty regular contact through physicians' letters.
Mm-hmm.
So obviously, I think the biggest problem is we have information, but there's still a lot of information we don't have. For example, when private providers are going to have access to the vaccine to distribute through, because we know like there's plenty of people who aren't going to come to a government site and they're not going to be interested in receiving it through our mechanisms. They're going to want to go through their private providers. And so there's plenty of things we know, but there's a lot of things we don't, like when are private providers going to have access to the vaccine? We wish it was yesterday. We hope it's tomorrow. We don't know when it's going to be.
That was actually my follow-up question. So you predicted that. Thank you.
Yeah, I mean, we're encouraging the state, anybody who wants to communicate with their legislators or the state in any way to encourage them to give access to the private provider network. I know that it's a huge logistic challenge for them to do deliveries of 100 vaccine to this provider and 50 to this and but that's going to be the only way that we're going to get out of this fast enough is if the whole system is engaged.
Have you gotten a lot of comments? I noticed on the flyer that the nursing home populations will be available at pharmacies. Have you gotten a lot of comments about that and about the ability for nursing home residents to get to pharmacies to get those vaccines?
So from my perspective,
them.
Good.
I mean, yeah, I'm sorry.
Yeah. No, go ahead. I mean, you were both trying to go to them. Yeah.
Yeah. The pharmacies are going to come to them. So it's a federal contract through Walgreens and CVS that will actually bring vaccine to the nursing homes and help them administer. Now, that sounds great, but the execution of that federal contract, just to be clear, so, we often, the state's we get critiqued, the state gets critiqued, the federal government gets critiqued. This is a federal contract through Federal Health and Human Services with CVS and Walgreens. State's trying to track it. We actually have only like the surface level understanding or knowledge, because that's all we're provided in terms of information about what's actually happening. And so I got a complaint today from a person whose father is in a nursing home saying my father's nursing home hasn't received vaccine. Why not? And for an individual nursing home, I don't think we have knowledge about when this particular facility is going to receive it or this one. And the big thing I think for us is, and I see James nodding his head, so I know he has a lot to say about this too. Nursing homes are first, long-term care facilities are second, and Development and Disability Association providers are in third, essentially. And our obvious concern is we're ready to move on to phase 1B, but the federal contract that's doing through CVS and Walgreens for these at-risk populations is not moving fast enough. Do we have to intercede for this multi-million-dollar federal contract and then use taxpayer dollars to vaccinate people who aren't being covered through this federal contract fast enough? And so we're looking at this. We're hoping the state will provide us more information. I'm sure the state is hoping the federal government will provide them more information. We've got a change of administration a week from today, and we're hoping that will provide some more knowledge about the process. But it's incredibly challenging for all of us because we don't have as much information as we would need to know to just understand how fast that process is going to go. So I think we have lots of concerns.
Yeah, and it's just that. And the only two pieces that I like to add to that is that we've been in conversations with all of those entities under the 1A tier 1. We've been in discussions with those congregate living spaces, those developmental disability folks who may not receive a vaccine until March, is what I was told the other day. So we're talking to the key stakeholders and folks involved there. Unlike the hospitals, we have been in conversations with the hospitals. We pretty much know what they have, what's been allocated, folks that they're vaccinating, talk to them about using their unused vaccine and providing part of our list of individuals or categories that we have. We've requested a list of those pharmacies participating in the federal partnership with the Maryland Department of Health and with the CDC, and we haven't gotten it yet. That doesn't mean that we aren't going to get it, but we're interested in talking to them to see what their strategy is, to see what their planning is based on their prioritization, and if in fact there's any partnership there either to consume some of the vaccine or either help them get the shots in folks' arm faster. So that's pretty much the disparity between the two, and understanding and working and collaborating with those two entities that receive the Pfizer vaccine.
Do you have any further questions from anyone?
I'm curious. I want to, when we talk about, so there's like 3 different streams of vaccine access right now. It sounds like there's the hospitals, the CVS Walgreens contract for nursing homes, and then the ones the county gets. What is reported on? Like, you guys say you don't know a whole lot about the CVS and Walgreens nursing home contract and what's going on there. So are those numbers included in the metrics that you report out each day or week about vaccines, or is that completely separate?
So the data that's reported is from those 3. They are from those 3 entities, but it's the overall state rollout. Since they provide the vaccines, we focus on the Moderna vaccine that we have. We can see those allotments and those allocations, but we have no influence or management or oversight over that. We take the data, we extrapolate the data for our purposes based on what we have. When we have the allotment, the percentages, we reconcile it with what the state has indicated, because in some cases there's a lag and we may be reporting 98% and they may be reporting 67%, but that may be the inclusion of the doses that they have allocated to us, but we haven't used yet. For those other 2 entities with the pharmacies and the hospitals, they provide their data to state, so we could see what those data points are, but we have no influence or management or oversight of those data points. We can see various racial and ethnic data. Again, we have no control over the data that we receive as far as the state level summary.
And I just want to clarify, and Jay, this maybe I may not know this as well. Do we get the micro level data from the long-term care facility clinics, like this site, this individual location got this much dosage, or do we get the more macro level of this much long-term care facility dosage went out to Montgomery County residents yesterday?
It's more the macro level.
Right. So that's what I thought. So like, for example, we know based on the report the state sent today, 23,412 people in Montgomery County have been vaccinated for first doses. We know that we've done 12,505, according to the state report, of that number. That other 20, or that other rough math, 11,000 or so vaccines, we know some portion of that came from long-term care facilities, some portion of that came from hospitals. But and we could kind of figure out based on, because individual hospitals get some reporting, but systems also are lumped together. We could figure out some portion of that other vaccine, who got what, but I don't know that we could say, I don't know, Shady Grove Nursing Home has received X doses. We don't know that.
Right.
Okay. Any closing questions here? We're a little past 9 o'clock. Dr. Bridges, we want to thank you for coming out and answering these questions this evening. Obviously, this is of utmost importance to us as we try to recover from the pandemic and get through this in one piece together. So looking forward to this continued partnership, and certainly anything that this committee can do to share information with the communities that we all represent, we're more than willing to do. So thank you for coming out.
Thank you for inviting me, and thank you, Dr. Stoddard, for following up, because with Dr. Gales being out, my inbox is overwhelmed, and I didn't see the invitation. So I appreciate the invitation, and always an opportunity to share what I know as best as possible. It's a lot of information. It's very complicated information, and we're working very diligently to synthesize that information to build a best practice platform. As we indicated before, we're at number one, and it's due in part by the partnerships, the discussions, and the collaborations across the county. And so as we continue to push forward, we continue to solicit this body's support in what we do. So thank you again.
Very informative, thank you. Hand claps, hand claps. Good stuff. All right, I'm gonna pass it over to Adriana.
Thank you, Elijah. Thank you, Dr. Bridgers, for a great presentation and discussion. I just wanted to let everybody know please save the date for our next meeting. The February meeting of the CRAG is scheduled for Wednesday, February 10th. And I'll follow up with an email, with a save the date email.
Adriana, is there a topic for that meeting yet or not yet?
Not yet.
Thanks.
If you have any suggestions, now's the time.
I'm sure there'll be plenty to talk about.